Well, you made it this far. If you're watching this video, it means you're probably suffering from some kind of shoulder or arm or hand pain. Maybe you've been diagnosed with a problem with your rotator cuff, maybe you're diagnosed with carpal tunnel syndrome, maybe tennis elbow or golfer's elbow, something like that. Well, I'm going to tell you something. I've been working in this for a long time, and I'm kind of a specialist in shoulder injuries because I had tons of shoulder injuries from my sporting career and from working as a chiropractor, until I learned what's actually behind shoulder injuries. Now, shoulder injuries and hand injuries like carpal tunnel and elbow, tennis elbow, these types of things, they're caused by a double, actually usually a triple factor. Usually overuse in the joint. Yes, of course, that's part of it, but that's not all. The biggest things that happen when you're getting those injuries with the shoulder, elbow, and hand or wrist is your neck loses its proper position and the upper back loses its proper position. You typically tend to get into that position. You usually see this in people who play sports like tennis, volleyball, even golf with, the heads down, they're doing those swings like that. What happens is you get massive tension on the spinal cord, and that massive tension actually pulls up on the nerve roots, which go like fingers and branch down and send these nerve trunks to give life energy from the brain to the shoulder and the whole arm, okay, including the elbow and the wrist and the fingers. That's one thing. The second thing is the blood supply from to the shoulder, arm, and hand originates down here. It comes off of the aorta, branches off, becomes something called the subclavian artery, subclavian under the clavicle here. And when you tend to get the head forward position, you cut off that subclavian artery. So you reduce the blood flow and the nerve flow to the shoulder, the elbow, the wrist, and the hand. Could that be a problem? Could that be why maybe after the carpal tunnel surgery or after the shoulder surgery, you're still having issues? Of course. See, every part of the body needs a blood supply. It takes the nutrients and the oxygen to the muscles and the joints to keep things working. But also you need the nerve supply. The nerve supply carries the actual life that tells that area of the body how to live and what to do. So if you've got that bad neck and you've got that chronic shoulder pain, even if your neck doesn't hurt, it's still the primary cause of those injuries. Whether it's rotator cuff, whether it's capsule, whether it's biceps tendon, whether it's tennis elbow, golfer's elbow, or carpal tunnel syndrome, there's always a component of lost nerve supply and blood supply from having a mal-shaped neck. To find out if you can get onto a better way of healing those injuries, give me a call. Let's check it out. We need 10 minutes with you in the office. We need 10 minutes with you to get some pictures taken so we can really get to the cause of those injuries that you're suffering with. We can eliminate those for you. It's exactly what I do. I've been doing this for a long time now. To do that, to schedule your exam, give me a call, 550-9544. Let's get started. Let's get you on a better way to feeling better and having a body that works better for you. Sounds good? You can get back to doing the things you love and some of the things that you have to do. Anyhow, give me a call. Looking forward to meeting you. Dr. Deutscher. Take care.